Well, we continue to provide you with the facts, not fear, on the coronavirus pandemic. And according to numbers from the Erie County Department of Health now, the county is approaching the CDC's threshold of being a high-risk area, up from the current designation of substantial risk. Channel 2's Jeff Preval is asking the questions tonight of what the impacts we could see here are. Hey, Jeff.
Yeah, hi there, Scott. Well, it was just a few weeks ago when the county reached substantial risk of transmission. Masks were required in county buildings and people indoors and public places were recommended to mask up. The county still has not outlined what, if anything, would change if the county were to hit high risk. Now, we wanted to ask Erie County Executive Mark Poloncarz about this today after a press conference he was at, but we were told he had a Zoom conference call this afternoon. It was not available for interviews afterward. His office did send us a statement, however, saying that there is no new info on any possible mask mandate. Now, in terms of COVID hospitalizations throughout the region, they are still much lower than previous waves, but they are still a lot higher than a year ago. Today, we spoke to the CEO of Catholic Health. What are you seeing on the hospital side of things in terms of COVID data?
We're seeing the majority of people coming in that have COVID are not vaccinated. But as I use my seatbelt example, there are people coming in that have had breakthrough symptoms. Remember, some of the times people are tested for COVID if they're coming in for a procedure, not because they have COVID symptoms.
Now back to the county's transmission rate. The state education department, in its reopening guidance for schools, recommends high-risk sports such as football be virtual or canceled in high-risk areas unless everyone participating is fully vaccinated. So if the county hits that mark of high risk, there will be questions not only to Erie County, but also Section 6. I'm Jeff Preval, Channel 2 News.